Hi, Jofi. Can you unmute yourself, please? Unmute yourself. Okay. And one more thing, please don't use virtual background. Okay.
Okay.
So because for me it's fine, but for during the interview they are not asking candidate to use virtual background because that interrupt or just take their attention not properly, right? So
Okay. So now
therefore,
this background is okay, sir?
yeah, but I think, are you using virtual background? I think so. It's a white wall or what?
Yes, white wall.
Okay, that's, I thought it's looked like a virtual background, so that's why it's fine, no problem. That is fine. So Jofi, the interview going to happen on this Zoom application, right? And the duration will be 15 to 30 minutes, the interview duration. And I'm going to tell you how the things going to happen in tomorrow's interview, what they are anticipating from you, right? And what you need to answer, and how they are going to evaluate your marks. And at the end, they'll release your result on the spot, right? So I'll tell you step by step so that you understand properly, and so that you can represent yourself properly in front of them according to their expectation. Is it clear?
Okay, sir.
Okay,
Yes,
perfect. So first of all, I have sent you an instruction message to your WhatsApp where I have asked,
I messaged to them through my Skype ID.
that is fine. So after this call, you need to send me a screenshot of that message so that I can convey the same with our client, because the thing is, first our client going to coordinate with you over Skype for coordination purpose between you and between interviewer, right? So what you need to do, you already have sent message. So now the next day they will send you some Skype message, message with some instruction, like you need to make sure about your audio, video, and you need to be in a private room where nobody can come during your interview. All this stuff they are going to send you through message. So you need to go through the message and read and respond them properly, that have gone through the message and everything is fine from my side.
Okay.
So once you confirm them, then they'll respond you accordingly, and whenever your turn will come, they will send you Zoom link and password and meeting ID to your Skype.
Okay.
Right? So the thing is, interview going to happen only on Zoom, not Skype. Skype is being used only for the coordination purpose between you and between our client. That's it. And you need to join Skype 15 to 20 minutes prior to your interview schedule.
Okay.
Right? 15 to 20 minutes prior to interview schedule, you need to join the interview Skype. And as soon as you receive their message, respond them accordingly. And accordingly, you need to join the Zoom session. Right?
Okay.
And also you need to keep original passport along with you.
Okay.
Because the interviewer going to ask your ID for verification purpose to avoid any issues in within the process, because they just want to authentify that they are interviewing the right candidate. So therefore you need to keep the original passport. So as soon as you join the interview session on Zoom, then you will see two panelists in front of you. There will be two panelists, right? And then they will first introduce themselves first, and just after their introduction, they will ask a ID from you. So at that time, you need to represent your passport wherever your name and other stuffs are appeared, right? So once they verify successfully that you are the right candidate and they are interviewing the right candidate, then they will move for the questions. Questions means they are going to ask 3 general nursing questions, right? 3 general nursing questions they are going to ask, and they are not going to ask any introduction from you. They are not going to ask any personal interest based questions such as why you wish to work in the UK, why you wish to work in Northern Ireland. They are not going to ask any such questions from you. Simply, they are going to ask questions related to general nursing, because this is for general nursing department, because
Okay.
because they just want that all candidates clear their interview, right? And after that, they post their OSCE, they will allocate them accordingly, right?
Okay.
So the thing is, 3 questions they will ask, and I have already sent you preparation material that most probably you maybe get question among these questions which we had
Okay.
collected from the recent interviews, right? So first of all, you need to listen their question very properly, very carefully. So therefore, I recommend to use earphone, and that's good that you are using the earphone and everything is working perfectly. So you need to use earphone, and your internet and audio video should be proper during that time, so that you understand their question, what they are asking. So first
Okay.
listen their question properly, then understand, then take your time, then start answering them. There are
Okay.
3 parameters that you need to cover in order to achieve the required score to pass the interview for each question. 3 question total, 3 question they will ask, and
Okay.
for each question there are 3 parameters that you need to cover. First, if you will provide appropriate answer related to that question, for that they will give marks. If you add some more additional information related to that answer question with your
Okay.
answer, for that they will give marks. And lastly, if you add some scenario based example or without scenario based examples with your answer, for that they will give parameters. But you need to keep your answer as long as possible, because they are looking candidates who can provide them the answers in depth with some appropriate examples. So this is
Okay.
so the same thing you need to follow for the next 2 questions. The 2 question will
Okay.
be different, like medication error or some diabetic patient things, or maybe some other general nursing question like chest pain management, or like they might create some scenario in front of you. For example, if they're asking, okay, uh, if any patient doing green vomiting, and you have seen there in your hospital, and then what would be your procedures, what you will do. So simply you need to tell them that whatever the procedure is being done by a nurse, you just simply to whom you will inform. So accordingly you need to answer them, right? Right.
Okay.
And another thing, they might also create them, they maybe also try to mold you in a question, right? Like how? Let me tell you. Suppose they will tell, like, suppose if you are seeing a patient shouting on your colleague, right? And the patient is not coming calm, right? She's not calm down. So what you will do, how you will calm the patient, how you will manage the situation. So now the panelists are focusing on your communication, that how you will communicate with patient to understand the situation, to calm the patient, and also also manage your colleague, right, to avoid any further issues. So there you need to first understand what is the issue between patient and your colleague, why patient is shouting on your colleague. Then you need to like, if any mistake from your colleague side, you need to apologize behalf of them, or you need to request your colleague to apologize if any error has happened by your colleague. So accordingly you need to communicate with them so that you control the situation.
Okay.
So their main focus is on communication, but maybe not, they might not ask the same question, because they are not asking the same question. This question was asked months back from other nurses. So I'm just telling you, I'm just sharing you the scenario thing, what and how they might ask and how they can hold it. but you
Okay.
need to understand properly and you need to answer them in detail in a positive way so that you pass the interview,
Okay.
right? And apart from that, there's nothing. They are not going to ask any specialized question. They are not going to ask any question which is not in your syllabus that we have given, right? Simply general nursing question. I understand, listen, answer them in depth. That's it, nothing else, right? Once
Okay.
you answer all of their 3 questions, then you will get congratulation message from them that congratulations, Jopi, your agency will contact you for further processing. This is how they are going to inform your result on the spot, right? And how they are going to evaluate your things. For each question, weightage would be 20 marks. So 3 questions weightage would be 60 marks. So
Mhm.
you need to achieve at least 42 marks to pass the interview from 60, total 60 marks, right? And
Mhm.
I have already told you the parameter, 3 parameter they are focusing: appropriate answer, if you add some more answer in depth for that, and lastly some example, some appropriate example. If you cover
Okay.
these things, simply you need to explain them. If they're asking about related to your things, understand, explain them whatever you are doing day by day at your place. If they're
Okay.
asking related to that, that's it. And there is nothing to worry about the departments, right? But the interview is for general. I have already explained you everything priorly, right?
Mhm.
I hope there is no confusion regarding the department allocation after going there, right?
Okay.
If they will be, if you are if you have an extensive experience in a particular department, so after going there, they are not confirming to any nurse from the beginning, but after going
Mhm.
there, they're assessing again, and if they feel, they can allocate you according to your experience, because this is very common thing. If you've got 10 years of experience or more than 5 years experience in a particular department, so why they will allocate you in general ward or other department, right?
Mhm.
Because that will not be beneficial for you as a candidate and for them as an employer, because you're already
Mhm.
working in international countries, right? So
Mhm.
this is very clear, and don't but they are not confirming in your offer letter, never, none of their confirming anything on candidate offer letter everywhere they are, because they just want to focusing on OSCE. Because if they mention, if they ask candidate to go for a specialized thing, so the nurse is going to get questions in their OSCE according to their specialization, and
Okay.
unfortunately nurses are not passing, right?
Mhm.
Unfortunately they are not passing. Okay, so to keep it 100%, 100% OSCE success rate, therefore general way they are taking, and later on the nurses are passing. And fortunately we have 100% success rate in our OSCE. Even for Northern
Okay.
Ireland, England part, we are placing Wales, Scotland, everywhere our nurses are going. We have so far 100% success rate in OSCE examination. But if I talk
Mhm.
about Ireland, like Ireland area, Republic of Ireland, there some nurses are failing in their adaptation or RCSI aptitude test, but not much, just 2% nurses only failing in their exam. But for UK part, we have 100% success rate in OSCE. So you don't
Okay.
need to worry about the department and all, right? So this
Mhm.
is the thing going to happen for tomorrow's interview, but you have to be very positive, very energetic with your answer. And if anywhere you stuck, you didn't get the, you didn't understand the question, just request them to please pardon or please repeat the question again, right?
Mm.
So this is how the thing going to happen in tomorrow's interview, right?
Okay, sir. Okay.
Anything else you want to ask, Jopi? Anything?
No, this 10:30 they are telling that, so I have the time here in Saudi Arabia is 1:30. That is
So at
correct, sir?
least, yeah, correct. 10:30
Mhm.
UK time. So according to your time is whatever you 1:30, it's like 2 hour, 2 hour, your time is ahead, right? Ahead or behind?
Mm. Yes, 3 hour here from India time, 2.5 hour between
Okay.
India and Saudi
Yeah, I've
Arabia.
just converted accordingly. I've sent you. So please just be
Mhm.
available accordingly, and just nothing to worry in this, right? And the
Mhm.
same day you will know the result, then we can process the thing accordingly. And you don't need to worry
Okay.
about visa processing, anything, everything will take care. right? There's
Okay,
nothing to
sir,
worry.
did they ask introduce yourself like that?
No, they will not ask any introduction, nothing. Just
So
after
no
verifying.
need for us to introduce ourselves to
No,
them.
no. They will not ask. So just be prepared for their 3 questions. Just understand.
Okay.
Tell them everything until they are not moving. Think, okay, fine, we are moving to next question. That means they are satisfied with your answer. So, but
Okay.
complete your answers for the next 2 questions also,
Okay.
right? So that they know that you have a good knowledge, you have good skills, good experience in your field, and you are the best for the position for they are looking for, right?
Okay.
And when do you want to relocate, Jofi?
So most probably I want May.
May. Okay. Okay, no problem. If you want to May, there is no problem. We can plan. Then you will receive your COS. If goes well, then your COS will be issued May. For May, you want to travel in May, right? May,
Yes,
mid
sir.
of May or first week of May?
Because I'm here, my contract will be finished on May 8th, like that.
Okay.
May 8th.
Okay, that means mid of May you will be able to travel,
Yes,
right?
yes. Mhm,
Okay.
yes.
So May, most probably in April or end of March, you will receive your COS to apply visa and all.
Okay.
Okay. So if you complete your file on time, then because if you're getting offered tomorrow, then you need to complete your file in January itself.
Accordingly. Okay.
January or maybe January or till mid Feb you
February.
can complete, because they need also
Okay.
time to request your CA so that you'll get your things done on time, so that you will not
Okay.
face any difficulties during your process.
Okay.
Okay, rest we need your commitment, and our commitment is always with our candidates. Rest you are not
Yes,
going
sir.
to face any difficulties at any place. This is assured from our side.
Okay.
Okay, yeah. So Jofi, do you have any friend who also want to work Northern Ireland or any other part of UK, as we have continuous interviews for UK and
I will check, sir. Actually, one of my friends, she's the one suggested me this ENS, and that's why she reached. I think 2-3 weeks before she reached there. So
what is her name?
that's why she Renju.
Okay, Rinju. Yes, I know.
Mhm.
Rinju, I assisted her. Yes, he's
Uh-huh.
went through her. So no worries, right? So
Yes.
you will go accordingly. But if in case you are getting any friend, you will get referral fee also, because you also
Yes, of
like
course, I will.
telling our if we are the good, we are assisting properly, why not you will tell. But just for like reward, we do not want that. We don't do anything for our candidate or nurses. So you will get that if they are going, if they pass OSCE, you will get that some referral fee also from our side.
Okay, sir.
Okay, so this is the thing, Jofi. Any other question you want to ask regarding the process? Anything you are I didn't cover during
Yes, sir.
this?
Can you hear properly, me, sir?
Yeah,
This audio and all,
I can
okay?
hear very properly. Your voice is clear, audio is fine, video is fine, everything's fine. So there is no problem. Yeah.
So this background is okay. I can.
Yeah, but this background is
do like
fine.
this.
White background is fine. I thought it's a virtual background. That's why I was just telling that time. But don't use this fine.
Okay.
This is fine. No problem with this.
Okay.
Okay. Yeah.
Okay, sir.
Okay. Thank you, Jofi, for your time. Have a great
Thank
day.
you, sir.
All the
Thank you.
best. Just be on time tomorrow. I will remind you again tomorrow morning. Okay.
Okay,
Yeah.
sir. Thank you.
Thank you. Bye. Have a great
Thank
day.
you.
Bye.